So when you're looking at injecting large joints, whether it's the hip, the knee, the shoulder, as the provider, it's essential to have a really good history, examination, orthopedic test, and the visualization skill set of your diagnostic ultrasound. This will help guide you. So when you're looking at a hip injection, hips are deep. There are a lot of providers that really don't like to do a hip injection because they are complex. They can be difficult to treat. But the providers that get really good at it, they can help so many patients, and this really comes with the hands-on practice.
Anterior hip injection. So with this injection, the patient is laying supine. I have a pillow underneath the knee of the side that I'm injecting. There's a slight external rotation. Bony landmarks, iliac crest, ASIS, femoral pulse. Right in between the femoral pulse and the ASIS, right along that natural crease, I'm going to place my transducer in a horizontal fashion. And when I'm putting my transducer down, what I'm looking for is what looks like an ice cream cone or a white dome shape. That is the femoral head, right on that dome shape right there. So once I have found the dome shape or the femoral head, I'm going to be sure and stabilize my transducer with my 4th and 5th digit. Now in my dominant hand, I'm going to take my 2nd digit and I'm going to very gently just move next to the transducer because I want to palpate the inguinal ligament that is going diagonally. And then once I find the inguinal ligament, go ahead and lift this leg a little bit, good. You'll actually, thank you. You'll actually, if you have the patient lift their leg while your finger's on their ligament, you'll feel that engage. So another way to palpate and identify where not to go. Now that their leg is relaxed, then, and I know where the inguinal ligament is, I'm going to go laterally or medially based on ultrasound. So I have the femoral head, I'm either going to go here or over here. When I move over medially, you can actually see the pulsation of the artery and the vein. Even if you have a black and white ultrasound, you don't have color, you can still see it blinking or winking. So I would not advise putting a needle through the vasculature, and that is approximately 2 to 4 finger breaths. On her, it's about 3 fingers distant. It might seem like it's a little close. It's actually, your screen is zoomed in almost 500%. When I measured hers, it's 3 full finger breaths apart. So now that I've identified and located everything, I've got my injection ready to go. Okay, there are my landmarks right there, the femoral head. And I'm actually gonna go in right there. Okay, so I have alcohol and I have chlorhexidine. There we go, a little pinch, 1, 2, 3. You can see that needle coming in. And I'm down, I'm touching bone, always aspirate. Now you can actually see in the ultrasound, there's the injection going in, and we are all done.
So whether you're looking at a lateral intra-articular visually guided injection or an anterior approach, I teach both of those. I spend a lot of time in class showing you how to place the transducer, what the anatomy should look like on the screen. How do I optimize my picture on ultrasound? Because it is deep, it is harder to see. And body habitus, that goes with every injection. What size is the patient? Because if you have a patient that has larger body habitus, whether they are a professional athlete or it's somebody who is morbid obesity, you have all these different things to come into play. And as a provider, you've got to be able to have that skill set. My job as a provider and my job as an educator when I'm teaching providers is let's get curious. Let's ask questions. So I take all these things into account when I'm training providers so that you are prepared for anything that walks through the door. Are they a good candidate to treat? Do they have red flags? Do I need to refer them out? Do I need to order an MRI? What is my next step as a provider so I can confidently help that patient? Clinic owners, are you looking for a way to build your practice, bring in more revenue, increase skill set of your medical providers? My injection training is your answer. I teach these hands-on skill techniques, musculoskeletal, aesthetics, you name it, every single month in Clearwater, Florida. So if you want to be able to gain the knowledge, gain the skill set, and this isn't just for the medical providers, this is going to be able to help your entire practice. How do you do sales? How do you close the patient? It's going to increase the knowledge base of all the staff, which will allow you to see more patients more effective with better patient outcomes. Click the link below, go to myinjectiontraining.com for more information, and we will see you at the next hands-on training.